Hi everyone, this is Dr. Cole Handy Jones here with your Handy Physical Therapy tip of the day. Today I'm going to be talking about one thing that you can do to instantly relieve your hip pain. So let's get started. Hip mobilization is something that I use in my clinic with my patients all the time, from people with back pain to hip pain and knee pain. So this is something that if I can have patients do it at home as well as in the clinic, they see even better and faster results. What I'm going to show you is self-mobilization to your hip joint. Self-mobilization to your hip joint is a way to increase your hip's flexibility or mobility. Hip stiffness has been related to back pain, hip pain, knee pain, and foot pain. So for you, if you specifically have hip pain, this is a great way to increase the motion in your hip by yourself. These hip mobilizations are great for someone who has hip osteoarthritis, hip impingement, or sometimes called femoral acetabular impingement, or FAI, as well as labral issues or groin-related pain that might be related to the hip joint. So for these exercises that we're going to do, you just need a few different items. The first one you're going to need is a band. So this is a big, thick exercise band. You can get it at a lot of different places, online, sporting goods stores, anything like that. If you find that you like one of these mobilizations, it might be worth the investment. They're not too expensive. The next thing that you're going to need is some kind of belt. So I've got kind of a special physical therapy belt that I'm going to use, and I'll show you as I do that. But you don't need one of these at all. Get creative and see what you have around your own house. You could try like a belt. You could try maybe the belt to like a robe, a tie-down strap for a truck, or just anything else you have. So get a little creative for the things that we're going to do with this belt, okay? We also need a weight, okay? So I've got a kettlebell here. This is a 25-pound kettlebell. You don't need something that heavy by any means. Just a light dumbbell can work, or get creative and see what you have around the house. Lots of different things can provide just a little bit of weight for the thing that we're going to use this for, okay? And then I'm going to show you one thing where you need a partner for, okay? So hopefully you live with someone who has a little bit of strength behind them. If not, that exercise might not be for you, but at the very least I'll show it to you. Okay, so for this first exercise, you're going to need a partner for, okay? Hopefully you live with someone who has a little bit of strength in their hands and weight behind them, but this isn't a hard technique at all, and it's pretty simple, okay? So this first thing we're going to do is called a long axis traction distraction. So basically what I'm trying to do is take the hip joint and pull it open out of its socket just a little bit. This feels really good to people with hip arthritis, hip impingement, or other kind of hip issues, okay? So what you're gonna do is take their affected leg. So on my example here, my partner, I'm gonna show it on her left leg is the leg that I'm gonna be trying to work on, okay? I'm gonna grab the leg, and we're gonna talk about this a lot, but there's positions in the body where joints are more open than not. And for the hip joint is the most open in about 30 degrees of flexion, 30 degrees of abduction, and slight external rotation. That means just make sure the toes are slightly pointed outwards, okay? This is going to put the hip in the spot where it's the most open or able to be mobilized, okay? Me as the partner here, all I'm going to do is I grab above their your big ankle bones, those are called your malleoli. I'm just going to grab right above those, I interlock my fingers, and all I'm going to do is kind of stand with my body weight and just lean backwards ever so slightly, okay? They should feel a little bit of an opening in their hip, and if they have a lot of pain, probably relief, okay? There's different ways to do this. One, you can kind of rock back and do little oscillations where I'm kind of going back and forth a little bit. They're just small, not real heavy. One, I can just lean back and hang out here for like 3 to 5 minutes until they get some relief, okay? The big thing that your partner should be telling you if there's any pain. If at any point there's any pain, back off and don't do it. But like I said, you really don't have to pull it hard. All I'm doing is grabbing and just leaning my body weight back ever so slightly, and it provides some opening in the hip joint. So try this one if you have a partner or someone available to help you. I think you really like it. The next one that I'm going to show you is one that you can do by yourself. This is one where all you really need is this big, thick exercise band that you can find at a lot of different sporting stores or online, okay? What I want you to do is I want you to attach it to a stair banister or something like that. So you can see I've got it right now in my stair banister. I want it up pretty high. The reason we're going to do that is, once again, it's going to put your hip in the open pack position or make that joint the loosest that it can. Okay, so put this up high. Then what you're gonna do, you're gonna take and put this around your foot. Okay, so the easiest way to do this, put it behind your heel, and then you're just gonna crisscross it, and then pull your toes upwards. That way it kind of stays on your ankle, okay? All I'm gonna do is lean backwards, okay? And let it just pull open my hip joint, okay? The nice thing about bands is the further I pull myself away, if I keep backing up my body, it's gonna open up my hip joint even more, okay? And it feels really good actually to me, and I don't even really have any hip problems, okay? While you're in this position, there's actually a couple different things that you can do. One, you can do what I call a contract, relax exercise, okay? So what you're gonna do, take your knee and your hip and try to pull your knee up towards your chest a little bit, hold for a couple seconds, and then let it relax. What that does, it's going to turn off all these muscles around your hip joint even more to let this joint relax even further. If you have a really painful hip, especially if it's been painful for a while, all these muscles will probably try to guard and contract really hard. So sometimes it's difficult to get them to relax properly, okay? So you can do that, contract 3 to 5 seconds and relax for probably 3 to 5, maybe even up to 10 seconds. And you can repeat that a few different times, okay? Another thing you can do while you're laying here is just take your toes and kind of rotate them out and in a little bit, okay? Once again, while we're providing this traction force, it feels really, really good on the hip joint, okay? So this is a really easy one to do by yourself. The next mobilization that we're going to do is another one that you can do by yourself, and it's a very similar setup to the previous one that we just did. So I would take your band once again, tie it around a stair banister or something like that, okay? But for this one, we're actually going to put the band right up around our hip joint, okay? So for me, I'm going to take this, and I'm going to start probably nice and close, and I'm going to put it all the way up above my hip joint, okay? And then for this one, I'm going to lean back just a little bit, okay? Grab my knee and pull it straight back towards my chest, okay? And I'm going to kind of work it just like that, out and in, okay? You can try it a little more to the outside, a little more to the inside, okay? The same thing, this is gonna feel really good for your hip and should help open it up, okay? Now, rather than just truly distracting or opening the hip joint, we're actually pushing the hip joint what we call posteriorly, okay? And increasing the mobility on the back side of our hip joint capsule, which is usually a really big, important motion to regain, okay? Just work this back and forth. It should feel good. If anything is finding that it's painful, back off and don't do it. The next one that I want to show you is a very similar setup to the previous two, okay? So same band, nice and high on a banister, okay? And for this one, what you're going to do, you're actually going to turn to the side, okay? So for this one, I'm going to put my leg through it. I'm going to have it up on my hip joint, but I'm going to turn my body to the side, okay? And this one, same thing, we want it down as close as we can to the hip joint, okay? Just like that. I'm going to grab my knee and then work it very similar to the last one I did. I can pull it straight up towards the chest. I can pull it across my body a little bit. I can work a little more to the outside. But I'm just going to rock in and out of these different positions, trying to loosen up the capsule, okay? This is a big one for people, especially with impingement or hip arthritis. By pulling the hip further this way, we open up the capsule and relieve pressure on the inside of the hip or more groin type pain. So if you have pain that's more in the front of the hip or groin, I think you're really going to like this one, and it will really improve that hip mobility. Okay, so the next one I want to show you is another way to perform long axis traction or distraction if you don't have one of those big, thick exercise bands. So for this one, all I'm kind of using is a belt here. Once again, get creative and see what you have around your house. A simple belt that you use, a belt used for like a robe or something like that, a tie-down strap for a truck, anything like that you can use, okay? So I'm going to take one side and just put it around my ankle, okay? And just kind of cinch it up so it's nice and tight, okay? I'm going to put it around a banister, okay? And then all I'm going to do is lay down, and I'm just very simply going to pull, okay? Just like that. You have a couple options. One is pull and just hold for time. So 1, 2, 3, maybe even up to 5 minutes, okay, if you're able to withstand that the whole time. Or for this one, it might be better to kind of rock in and out. So you pull and release, okay? I find that this one's a little bit harder to get true relief with because you're trying to pull so hard here while trying to relax down here. And it's also hard to get your band higher up on the banister, which is going to put the hip more in the open pack position. So sometimes you have to settle with it being down low a little bit, okay? But it is one that some people have really liked, so I think it's worth trying at least, okay? So this next one that we're going to do is usually the one that actually people find the most relief with. It's just kind of trickier to get set up, okay? So for this one right now, I'm going to use my stairs. At home, you can use a chair, or if you have a bigger box that stands up off the ground, any of those work fine. I figure most people probably have stairs, so I'll show you here first, okay? For this one, all I need is that rigid belt that we've talked about, okay? Get creative, look at what you have around the house, and some kind of a weight. So I've got a kettlebell. If you don't have a kettlebell, you can use some kind of dumbbell. You can even, at the very least, just take a bucket, fill it with water or dirt or a bag of rice or something like that, and kind of use the bucket there. And that's kind of easy to add or subtract weight depending on what you're feeling. Just get creative and see what you have, okay? So for this exercise, what I'm gonna do, and if you're doing it on stairs, this is usually the easiest way to get it set up. Stand in the middle stair with one above you, one beneath you. Have the weight on the one beneath you, okay? And what you're gonna do first, I'm gonna take my belt and kind of thread it through my weight. So for me with the kettlebell, it's pretty easy. I'm just gonna kind of go around there, okay? I'm then gonna take this and put it around my foot, okay? And just like we did on the very first one, I'm gonna kind of turn it so it kind of gets stuck there on my foot, okay? And for this one too, you probably want this cinched, not probably, you do want it cinched pretty tight, because then when you go to stand up, it's gonna give you more relief there. So, do it just like that. And then cinch it up pretty tight. Okay, now what I'm gonna do, I'm gonna step up on the stair above me, okay? And very simply just pull up and let that weight just kind of weigh my leg down, okay? This is a 25-pound kettlebell. This is heavier than I tell most people to use. You're probably good with more like 10 pounds and just let that open up your hip, okay? You have a couple options here too. You can do like little movements with your hip, okay? And just kind of find where it feels the best or gives you the most relief. You can let it just hang there and simply pull the hip open, okay? Or you can do that contract relax again we talked at the very beginning. I can actually take my knee and pull it up towards my chest a little bit, hold for 3 to 5 seconds, and then let it totally relax as it comes back down. Pull the knee up towards your chest, hold for a few seconds, and then let it totally relax again, okay? This is one that should provide a lot of relief as it's opening that hip joint. And that's it. I hope you learned something of value today. If you liked one of these hip mobilization exercises and it seemed to help, hit that thumbs up button and subscribe to my channel. There's gonna be more videos every single week to help you live healthy. I want you to comment down below which mobilization helped you the most. Thanks so much. All right, see you later.